everyone. It's 10:30. Time to start the first of our three-part series on smart moves in challenging times. Welcome to the three-part web series. Our mission is educating you on the power of using experts to help you. Because Medicare, long-term care, and trying to tame the volatile stock market. When you're empowered with accurate and efficient information, you can protect your family well, spend your healthcare dollars well, and remain calm and confident in your daily lives. The group of experts we have today includes Keith Nabb of Affordable Medicare Solutions, Michelle Pillow of Pillow Financial, and Angie Rakeup of Financial Care Providers. Each expert will highlight one area of information in each 20-minute program. Today, we will hear from Keith Nabb on making Medicare work for you. On Wednesday, we'll hear from Michelle on challenging long-term care market. On Friday, Angie will teach us how to be confident and flourish in a down stock market. Keith has been helping families and seniors for 25 years to navigate the medical plan market. Medicare is not set it and forget it. Keith's staff of 9 employees manages the Medicare plans of thousands of Georgia seniors. We will have a question and answer session at the end of the presentation, and you are welcome to use the chat feature in Zoom to send questions during the presentation. Keith, please introduce yourself.
Thank you very much, Angie. I'm glad to be here today. I hope everyone had a wonderful weekend. Affordable Medicare Solutions is the leading Medicare planning agency in Georgia. We're also the largest provider of Medicare education in Georgia. I teach at all the local hospitals and senior centers, just about any place that needs education to both professionals and to consumers, and also to their adult children who are helping out their elderly parents. My staff is a staff of myself and 8 employees. We have about 100 years combined experience in these issues, and it is a changing market all the time. And then you throw in something new like our coronavirus, and we have to find all the new ways to handle these issues. So I hope today will be a valuable information for you, and we will answer those questions at the end of the session. Thank you very much. I'll get to that. This is called Making Medicare Work for You. And it's important because Medicare is not set it and forget it. Medicare is something you manage on a year-by-year basis, or if you have special circumstances that occur. The first thing that everyone should do who has Medicare should create a Medicare.gov account. Now, this started to be a very valuable account October 1st of 2019. So a lot of people that already had Medicare don't realize they can go back in now, like they did with their Social Security account, and they can create a Medicare login. The importance of this is that if you already have your Medicare, either just the hospital-only portion or Part A and Part B, that allows you to create this login and password. And you're going to be able to manage your account there. And what I mean by manage is if you need a temporary or extra Medicare card, you can print one out. You can see the in-force status of all Medicare plans you have. And you can also analyze and select new Medicare plans, such as the drug program, the Part D plans each fall in October and November. Now think about this. If you were taking care of a parent, this would be extremely valuable for a trustee or an adult child, a power of attorney, to have this Medicare account information in case there is an emergency or a crisis, that you can easily get in and see what this person has and explain that to the providers or anybody else that needs the information. Really important stuff. Now, to do this account, it's not hard at all. You go to Medicare.gov and you hit create account, and you'll put in your date of birth, your zip code, some information off your Medicare ID card. It really just takes a minute to do this. But write down your password. People forget those passwords, and it's important that you have it in a safe place. Keep that with your other medical information. Now, once you've done that, now you can start looking at the other parts of Medicare where people get a lot of discussion today and get a lot of confusion, because Medicare does offer both traditional and modernized new Medicare programs. So when you look at Medicare, it has modernized greatly over the past 15 years. It was 2005 when Medicare created these one new pathway of access that left alone the traditional pathway and created the new HMO/PPO style of Medicare. And to understand this difference is vitally important because there are some significant differences between the two. And I have written a Medicare 10-page electronic booklet and also 1-page educational flyers to help people understand these two pathways. I actually give a 1-hour class on this change to Medicare, and it's pretty interesting. 2025. But let's talk about the basic differences on Medicare. Basically, with traditional Medicare, we call this prepaying for your medical events by purchasing a simple Medigap insurance policy. Now, that insurance policy is easy, a very, very easy thing to create and to have in force, and it works very well, and it has for the last 35 to 40 years. Basically, if you go the other way in Medicare, you're not paying early, you're paying when you need care. We call that pay as you go. And so when you would go to the doctor or the hospital, you would pay a copay as you go along. So some customers say, you know what, I really just want to have total peace of mind. I want to prepay for my medical events. That's fine. And now half of the consumers are saying, no, I'd rather just pay as I go along. And a lot of times they are choosing those new plans because there are thousands of extra dollars in extra health care benefits on the new plans. And that's where we're seeing a lot of people leaning towards those plans right now because of those extra benefits. Those extra benefits can include extra things such as dental, vision, hearing aids. Medicare doesn't pay for dental care. Medicare doesn't pay for vision care. Medicare does not pay for hearing aids. But the new Medicare plans can do this. Do not buy a Medicare plan because it's going to give you a hearing aid unless you are checking everything about that plan, such as your doctors, your hospitals, your prescription drugs, making sure that you're not making a mistake. A lot of the plans include gym memberships, or they'll pay you to do your immunizations and your well care. These are extra incentive payments. That's not Medicare paying you, that's the plan incentivizing you. And a lot of the new plans also give you medical items that are over-the-counter medical items like Band-Aids or extra items such as sunscreen or vitamins or over-the-counter medicines that used to be prescription but now are just over-the-counter. They'll give you those for free. Pretty amazing, but those are healthcare items you're going to use, and it helps to reduce your healthcare expenses. A new one that a lot of the plans are doing is meal delivery. After a hospitalization, it makes sense to feed people, especially if they're socially isolated, to give them food to make sure that they stay from readmitting to the hospital. I have a feeling in 10 or 15 years, that's going to become a normal part of all of Medicare. But right now, it's just under certain programs do this. And finally, on the last category, there's also a very, very small number of new plans that do provide some home care assistance and or transportation benefits, medical transportation or sort of more casual transportation to get people to their gym or to other things for their health and their social determinants of health to help them to stay active in their community. If people don't use the new programs, the new Medicare programs, they're going to be accessing the traditional side of Medicare. Half of our clients and half of people at age 65 utilize these wonderful programs. It's called a Medigap insurance policy. These simple, small insurance policies pay for what Medicare leaves behind, but there's a cost for that. You're going to spend between $130 to about $230 per month. Most people are paying on the low end about $130. And this supplement Medigap plan makes no decisions on your health care. You're asking your doctor or your provider if they take Medicare. It doesn't matter which company you are signing up with as far as the payments go for your health care. Medicare is instructing that hospital and that doctor once they send in the bill to Medicare, Medicare instructs the supplement to pay the hospital and doctor, and the hospital and doctor does not have to join any network. These plans have been around for 40 years and have been really, really solid, and your coverage will not change throughout the United States. So if somebody is a snowbird and they have a house in Georgia and also one down on the Panhandle, that's fine. It's going to work the same both places. So these are very, very strong options and very, very consistent and easy to use. So we have thousands of clients on traditional Medicare using a Medigap plan. Now, when you do a Medigap plan, you do have to buy a Medicare drug program separately. It will be an additional feature. Now, this is really important, that part of your management of your Medicare programs is that you need to do an annual review, because you need to make sure things are going to be okay on the upcoming year. Too many people don't do this, and they find out in January or February that, oh no, one of my drugs is not covered, or oh no, my pharmacy is not preferred anymore. My drugs used to be free or maybe $1 a piece, and now they're $5 or $10 because it's a non-preferred pharmacy. The next thing is you must also make sure that your doctor and hospital are covered. Talk to your doctor in October and say, I want to make sure you're not, making any major changes. We're seeing a lot of doctors have sold their practices and are joining larger groups. So there are changes. We've seen fights between hospitals and certain programs, but you just need to have that conversation, and you need to ask your Medicare agent, your Medicare resource office, to make sure that you're not confused if you hear that a hospital's in a fight, to make sure that it's not affecting Medicare. Sometimes it only affects employer group health insurance and doesn't affect Medicare, but the seniors get very confused. But here's a real big one. You need to make sure that you're not being overcharged for any of your plans. Unfortunately, a lot of times the drug programs will start out very inexpensively at $15 or $20 a month, and they'll sneak the prices up to $30 next year, or to $50 or to $79, and people don't pay attention, and they're stuck overpaying for an entire year or two because they're not managing those programs. You also need to be advised of any new Medicare rules. There were some changes this year that affected younger seniors and did not affect older seniors on the Medigap programs. So that was a big confusion for some families, where you had one senior who was already 67 years old, and the spouse was 65, turning 65, and they're given different options. I had to do a lot of explaining to husband and wife couples this year about the differences on the Medicare rules on January 1st. You also need to tell your Medicare agent if you're having any special upcoming life events. If you're planning on moving, let them know, hey, we're moving to Savannah, Georgia. We need to know if our Medicare plans are going to change from Atlanta. So it's really important you have those conversations, and maybe not just at the annual review, 2 months prior to a move or something big happening. If you can, give your Medicare agent a call so that they can tell you if it's going to impact your programs. Don't assume you're fine. And if you're an adult child helping your parents, you especially need to ask those questions. Now, what if you do mess up and do not take care of that Medicare review in the fall annual enrollment period? That enrollment period is October 15th to December 7th. This is very important. That has been set on those dates for about 5 years now, and it has been very, very strong that sometimes people think that they can do it all the way till December 31st. You cannot. It's up till December 7th. And the reason they chose that date is that so that if people do make a change, it gives the companies time to print their ID cards and get them to them before January 1st. Now, if you've forgotten to do this, some of the programs can be quote unquote fixed in the first quarter, the first 3 months of the year. This is a new thing that started last year called the open enrollment period. And the plans that fall within that rule are the Medicare HMO and PPO options. So if somebody finds out their doctor is not in their HMO plan, which has got a very restrictive network, they can switch over to an easy to use open access PPO network. If you do not have do this during the first 3 months of the year, you could have a special exception later in the year, such as a move to a new house. Maybe you've had a dramatic income change. Maybe you had a loss of a spouse. or you might have applied for and received assistance under some of the federal assistance programs, such as for the low-cost subsidy for prescription drugs. These will give you additional special rules that we can help manage your Medicare outside of the annual period. You generally get about 60 days around that event to make that change. And if not, there's other things we can look at to possibly massage the situation in your favor. Very infrequently, but sometimes we can make those things happen. The Medigap supplement programs in Georgia can be changed year-round. They don't fall under the annual enrollment period. So I'll have people call me in June and say, my neighbor's paying $75 a month less than me, Keith. Can I try to get a lower price like they have? And I'll say, sure, and we'll go ahead and reapply for a new Medigap plan in the middle of the year. That's not a problem. And you can change your plan whenever you feel like it on those programs. Now, let's talk about this very frankly. Are all Medicare agents the same? Unfortunately, absolutely not. Most Medicare agents are what we call set it and forget it salespeople. And I don't want to be negative about this, except that it's just not right to set something and forget about it, because it changes every year. And if you have a person that did sign you up for a program and you haven't heard from them or can't find them, that's the type of person the Medicare agent that they are. Only a small percentage of Medicare professionals provide the actual annual management and year-round advice and service. You know, most Medicare agents are a one-man shop, and they don't have the service ability, and they don't have the staff to help people year-round. Also, make sure that you have a Medicare professional that will show you all of the options available to you, and not just a select few. Some Medicare agents say that they are brokers and they represent multiple options. Well, there's a lot. There's like 41 to 50 different Medicare plans per county in the metro area. And sometimes a Medicare professional might only represent 2 or 3 of those options. Also, this is crucially important. Only use a Medicare agent that provides all of their services at no charge to you. Make sure that is very, very important. Now let's talk about some things going on with the coronavirus and some improvements to Medicare that were very timely, that happened prior to the coronavirus. And one of those items is that there's telehealth services. Telehealth is talking to your doctor by FaceTime, by teleconference, or just by a phone call. I've done that recently with my doctor. It was very convenient and safe, of course. Now, you should also pay no fees for any coronavirus testing. So call your doctor. You can do that. And we're probably going to have soon antibody testing, which is for people who already had the coronavirus. Maybe they didn't know it, maybe they did know it, and they wanted to see if they built up an immunity with some antibodies. We're going to see those tests coming in the next couple of weeks. The FDA has approved one so far. Now, you can also get early refills on drugs from your pharmacy. A rule was relaxed where the state of Georgia helped on that to get 90-day early refills on drugs as long as they weren't certain controlled substances. You can also pay no fee for drugs to be delivered to your home. Most every program should have that. And this is an interesting rule. On traditional Medicare, there's been a rule where you had to be in the hospital for 3 days to qualify for rehabilitation care. The HMO and PPO plans have never had that rule, but the traditional Medicare has, and they relaxed it and suspended that rule so that people can get out of the hospital quickly and free up beds for other patients that need it. I think it's a smart suspension right there. There's also new benefits that you can take advantage of, such as over-the-counter benefits and at-home fitness programs. Because the gyms are closed, a lot of the plans are offering you online at-home fitness programs or mailing you equipment that you can use at your home. So if you have the Silver Sneakers or Silver and Fit programs, you can call them and see if they've got at-home programs that you can use to make sure you don't add 15 pounds during this social distancing time. So today, I'm going to turn this back over to Angie, and we'll also take our questions at the end. Thank you.
Thank you, Keith. That was a very interesting and certainly a lot of timely information. Families need your services for sure, including my own. And that you do all this at no charge is a blessing during this challenging time. You can see this presentation on Keith's YouTube channel, or we can send you these slides by emailing keith@amsplans.com. Just let us know you attended and request the slides, and he'll get them right back to you. Keith has a wealth of educational material for free download on his website at www.amsplans.com. This coming Wednesday at 10:30, we'll be educated by Michelle Perlow of Perlow Financial. She is an expert in the long-term care planning and funding. You don't want to miss her innovative ideas and her creative approach. She has fixed lots of problems and found very much solutions for clients of my own. Thank you for viewing today. You're going to receive a $15 Uber Eats meal card for each session you fully attend. See you back here on Wednesday at 10:30. Thanks for coming.
We have any questions? Did we have any questions come through the chat? Are there any questions there, Angie, or
No.
are we ready to wrap up?
I do not see any questions at this time. If you want to ask your questions privately because they might involve your own health, your family's health, please email Keith at amsplans.com.